So the question is, what is craniosacral therapy? To start to address that, I'll just say quickly what the craniosacral system is. The cranium, the head, sacrum is that triangular bone at the bottom of your spine. So the craniosacral system includes the skull, the spine, and the sacrum. And so the craniosacral system is the system that houses your brain and spinal cord. It's the system that houses the central command system of your entire body. And the way you interpret your experiences, on some levels anyway, and how you respond, relates to popular topic nowadays being in fight or flight mode, too much stress from modern society. So that all relates directly to the brain and the spinal cord, the way it's interpreting signals and the way it's able to respond to them and help the body to relax or respond in more of a fight or flight mode. Craniosacral therapy is a modality that we diagnose, we evaluate whether the system is working properly. If it's working properly, it's actually moving very subtly. It's a very refined ability to feel that, but when you're able to feel that, you can tell as it's expressing throughout the body. You can determine areas in the body that have some sort of density or stagnation, something that's keeping the body from moving properly in response to the movement of the craniosacral system. So for the system to function properly, the body has to be soft and fluid and mobile, and the tissues have to be like that. So in a treatment, by evaluating a person according to what I just described, that helps you identify, and then your job is to remove those obstructions, the hindrances, the density. Some aspect of the body that's not flowing right, that's not able to circulate properly, that's not able to take care of itself properly, resolving that with the ultimate goal of having the craniosacral system itself functioning fully so that you're able to basically live your full life. Your body will automatically try to get you out of pain and will automatically work to fix things, something that we all experience in multiple 1,000 different ways. You cut your hand or something like that and it'll just fix itself. So the body's always working on resolving stress or getting back to basically enabling you to enjoy your life to its fullest, to be able to do everything you think is in your own best interest, to be happy, to be unrestricted, to not have as much of a difficult time as people tend to do, depending if they're overstressed or have an injury or a trauma to the body that the body hasn't been able to resolve, and it's now interfering with the body functioning right. So it's very broad, and since it treats the central command system of the body, it can impact and help somebody with a whole list of conditions, and certainly resolve pain and soften things and make it easier to move, get rid of back pain, neck pain. When the therapist identifies where the restrictions are and removes it, and the body can, get back to fixing itself and getting the person out of pain. You can check out the website, livefullynowrehab.com. livefullynowrehab.com if you want to see like a list of various different conditions that can benefit from it. But so that's what craniosacral therapy is. It's good for only if you're like a living being, like with a skeletal structure. Animals, they do craniosacral therapy on dogs. Cats aren't as open to it as dogs tend to be. Horses. But yeah, if you're a human being, craniosacral therapy is great for you. And especially if you have something obstructing the proper function of your body that's interfering with the craniosacral system working correctly, which is not diagnosed by anyone who's not trained to do that, anyone who doesn't do craniosacral therapy at a high enough level. The vast majority of people won't be able to diagnose it. So if you're having trouble that you're going to multiple people and they're not resolving it, definitely check out craniosacral therapy, whether it's through me or somebody else. Make sure they're experienced enough and a high enough level at it, because that might be just the answer that you're looking for.